Hello, I'm Professor Peraza, and today's video covers health and food security. We will be discussing the definitions of food insecurity, how food insecurity impacts health, the social determinants of health, and ways to combat hunger. These are the specific learning objectives for this module. This module also meets the following course learning objectives. For this lecture, these two free textbooks are your primary reference materials. More information, including page numbers for readings, can be found in the Canvas course space for this module. Before we get into the definition of food security and food insecurity, I want you to take a moment and jot down what comes to mind when you think of food security. What would food security look like to you? Food security is having access to enough foods at all times to lead an active, healthy lifestyle, and includes being able to acquire nutritionally adequate and safe foods in socially acceptable ways. Food security includes at a minimum the ready availability of nutritionally adequate and safe foods, assured ability to acquire acceptable foods in a socially acceptable ways, that is, without resorting to emergency food supplies, scavenging, stealing, or other coping strategies. Food insecurity is the limited or uncertain availability of nutritionally adequate and safe foods, or limited or uncertain ability to acquire acceptable foods in socially acceptable ways. Food security language was updated in 2006 by the USDA to a continuum with 4 ranges. High food security, which is when households had no problems or anxiety about consistently accessing adequate food. Marginal food security, which is when households had problems at times or anxiety about accessing adequate food, but the quality, variety, and quantity of their food intake was not substantially reduced. There's little or no indication of changes in diet or food intake. Low food security, which is when households reduce the quality, variety, and desirability of their diets, but the quantity of food intake and normal eating patterns were not substantially disrupted. There is little or no indication of reduced food intake. Very low food security, which is when at times during the year, eating patterns of one or more household members were disrupted and food intake was reduced because the household lacked money and other resources for food. USDA describes households with high or marginal food security as food secure, and those with low or very low food security as food insecure. Placement on this continuum is determined by the household's responses to a series of questions about behaviors and experiences associated with difficulty in meeting food needs. According to the USDA, 13.7%, 18.3 million of U.S. households were food insecure at some time during 2024. Household food insecurity affected 18.4%, 6.7 million of households with children in 2024. In some of these food insecure households, only adults were food insecure, while in other households, children also experienced food insecurity. Both children and adults were food insecure in 9.1% of households with children, 3.3 million households. In thinking about the USDA descriptions for food security and food insecurity, consider your household food situation over the past 12 months. Reflect on your own experience and how this relates to the USDA descriptions. In 2010, doctors Aaron Hagar and Ann Quigg and the Children's Health Watch team developed the Hunger Vital Sign, a validated 2-question food insecurity screening tool based on the U.S. Household Food Security Survey model to identify households at risk of food insecurity. The Hunger Vital Sign identifies households as being at risk for food insecurity if they answer that either or both of the following 2 statements is often true or sometimes true versus never true. Within the past 12 months, we worried about whether our food would run out before we got money to buy more. Within the past 12 months, the food we bought just didn't last and we didn't have money to get more. When conducting the screening, it is important to explain that all individuals are asked to complete it. This is important for reducing stigma and embarrassment. Food security screening questions can be administered to patients verbally or in a written form. If a referral is warranted, ask permission of the individual to provide information on food assistance or specific referrals. There are a lot of things to consider with food insecurity. One of those is a food desert. Some low-income communities in the United States lack stores that sell healthy and affordable food. The lack of store access in these communities, sometimes called food deserts, may contribute to poor diet, obesity, and other diet-related illness. The definition developed by USDA, Treasury, and HHS is low-income census tracts with a substantial number or share of residents with low levels of access to retail outlets selling healthy and affordable foods as defined food deserts. A census tract is a small, relatively permanent subdivision of a county that usually contains between 1,000 and 8,000 people, but generally averages around 4,000 people. In 2009, the U.S. Department of Agriculture, USDA, began mapping food access to identify communities where there was low availability of affordable, nutritious foods, and found that food deserts exist in every American state in all types of communities. Food insecurity is a result of limited food availability due to inadequate physical access to food, in other words, food deserts, limited economic access to food, so namely poverty or high food costs, inadequate utilization, for example, lack of kitchen or household facilities for food preparation, or challenges in meeting the cost of living in a way that adequately addresses food needs, or lack of stability in one's environment or income, further disrupting physical, economic, or utilization capacity. Food insecurity does not necessarily cause hunger, but hunger is a possible outcome of food insecurity. Hunger is a discomfort, illness, weakness, or pain caused by prolonged involuntary lack of food. According to the WHO's State of Food Security and Nutrition in the World, SOFI 2025, an estimated 8.2% of the global population, or about 673 million people, experienced hunger in 2024, down from 8.5% in 2023 and 8.7% in 2022. However, progress was not consistent across the globe, as hunger continued to rise in most subregions of Africa and Western Asia. There are many programs available to address hunger and food insecurity. A food bank is a warehouse that collects and stores food from food donations and food drives. A food pantry is where people can get free food. A food pantry gets its food from a food bank and gives it directly to people. Mobile pantries bring free food and groceries to the community. SNAP, or the Supplemental Nutrition Assistance Program, provides monthly funds to buy groceries. SNAP benefits come on a card like a debit card. The amount depends on income and family size. Individuals cannot use SNAP for alcohol, tobacco products, vitamins, medicines, or non-food items. There are programs specific for children, and they include the Backpack Program, Kids Cafe, and Summer Food Service Program. Backpack food programs offer families free groceries for weekends and school breaks. Food backpacks include healthy, easy-to-prepare food for kid-friendly meals. Food banks partner with schools, boys and girls clubs, and community centers to distribute backpacks to kids. Kids Cafes are after-school programs that give free meals to kids after school on the weekends and during the summer. They also have fun activities and tutoring. Community organizations like boys and girls clubs, churches, libraries, and schools host these programs. Summer food service programs are free meals for kids and teens up to 18. They make meals available to kids when school is out in June, July, and August. You may hear them called free summer meal or lunch programs. Some summer programs provide breakfast and lunch. There are many different types of senior food programs. The Commodity Supplemental Food Program, CSFP, is a federal program. It provides monthly food boxes to people 60 years and older. Senior food box programs are monthly boxes from local food banks. Senior food pantries, home delivery is available from food banks, food pantries, the local Meals on Wheels program. And senior farmers markets help seniors buy fruits, vegetables from local farmers markets. Let's look at some additional federal programs in place to combat hunger and food insecurity. Women, Infants, and Children, or WIC, provides nutritious foods and nutrition education for low-income, at-risk women, infants. Individuals receive checks or vouchers to purchase formula, nutrition counseling, support from a lactation consultant, and screenings for other programs. There are eligibility requirements for WIC. The Special Supplemental Nutrition Program for Women, Infants, and Children, WIC, can help individuals get food, nutrition counseling, and social services referrals. The Emergency Food Assistance Program, TEFAP, is a federal program that helps supplement the diets of low-income people by providing them with emergency food assistance at no cost. During the school year, children can get free or reduced price meals at school through the National School Lunch Program. This is a federally assisted meal program operating in public and nonprofit private schools and residential childcare institutions. It provides nutritionally balanced, low cost, or free lunches to children each school day. The school breakfast program provides reimbursement to states to operate nonprofit breakfast programs in schools and residential childcare institutions. The food distribution program on Indian reservations provides monthly packages of healthy food. The social determinants of health are defined as the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. In the United States, people with more disadvantaged social determinants of health have a greater incidence of obesity, emphasizing the importance of addressing systemic inequities to improve the health of all Americans. There are 5 domains: economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, social and community context. The SDOH impacts an individual's health, well-being, and overall quality of life. Social determinants of health likely drive and compound the racial and ethnic differences in obesity prevalence. SDOH contribute to wide health disparities and inequities. For example, people who don't have access to grocery stores with healthy foods are less likely to have good nutrition. This raises their risk of health conditions like heart disease, diabetes, and obesity, and even lowers life expectancy relative to people who do have access to healthy foods. Let's review an example under the healthcare access and quality domain. For this objective, I chose oral conditions as the category and the specific objective of increase the proportion of people with dental insurance. When I click on this objective from the list, I could see that the status is improving. The most recent data is at 74.9% in 2024, with the target being 74.8%. The baseline was 70.3% of persons under 65 years had dental insurance in 2019. Under the summary for this objective, I could see that there's information about how poor oral health is linked to other health problems. Preventive oral health care visits can help identify diseases, injuries, and nutrition problems. Strategies to reduce financial and other barriers to dental insurance access may help increase coverage rates. If I were involved with the work group for this objective, I would want to gather information about the barriers to dental insurance. I would also want to provide education about the importance of oral health and the connection to other health problems. Starting with education in primary care settings could be a target demographic. Health equity is the state in which everyone has a fair and just opportunity to obtain their highest level of health. Achieving this requires focused and ongoing societal efforts to address historical and contemporary injustices, overcome economic, social, and other obstacles to health and health care, and eliminate preventable health disparities. Achieving health equity also requires addressing social determinants of health and health disparities. It involves acknowledging and addressing racism as a threat to public health and the history of unethical practices in public health that lead to inequitable health outcomes. Structural determinants, political, legal, and economic, with social norms and institutional processes, shape the distribution of power and resources determined by the conditions in which people are born, grow, live, work, play, and age.